Good evening, Twin Cities. This is your host, Clarence Jones of Community Health Dialogues. I know that you heard that first promo, and I couldn't do a LaDonna very well. LaDonna can do her own thing. But this is Community Health Dialogues, and we have an extended show tonight, and we're going to tell you a little bit about that. But we're excited to have you, and thank you again, as always, for listening to our program. Tonight in our studio, we have Dr. Wendy Hellerstedt, who is the Associate Professor and the Director for the Center for Leadership, Education, in Maternal and Child Health at the University of Minnesota. And Dr. Wendy and I have been talking off and on for about 12 years about maternal child health issues, and she finally has agreed to come and to grace our listening audience with some information around maternal child health. But not only that, but she has actually helped me put together a series of programs around this particular issue. Now, we're going to talk a little bit about why it's important for us to talk about maternal child health with her. But first, I thought it would be interesting just to introduce you to Dr. Wendy. She is one of, I told a little bit earlier, she was one of my she-roles, and I'll tell you a little bit more about why that is so, about who she is, and a little bit about the Center for Leadership, Education, Maternal and Child Health. So, Dr. Wendy, how are you doing?
I'm doing fine. How are you?
I'm doing great, and thank you again for being on our show. Why don't you first of all share a little bit about yourself with our listeners, and a little bit about the center?
Well, first of all, it's a pleasure to be here. And you're right, it's taken us a long time to do this, Clarence. I think we had an important lunch meeting where we decided we had to do it. About myself, I am an associate professor in the School of Public Health at the University of Minnesota. I've been there for about 20 years. My area is maternal and child health, and very specifically reproductive health. We run a master's program in public health in maternal and child health, and we also direct a center in maternal and child health, in which we provide education to the public and to professionals about a variety of things that concern populations we care about. Maternal and child health generally focuses on socially vulnerable populations. It's sort of an old-fashioned name, maternal and child health, but it's got a wonderful old history, Clarence. Our history is maybe a century old, maternal and child health, and it started with public health programs that were protecting the people who were most vulnerable in our society, babies and mothers. But maternal and child health has grown and expanded over the decades to include women, to include adolescents, to include children, to include youth with special health care needs, to include families. So we're sort of very broad-reaching. Our concern is making sure that there are public programs, making sure there are good policies, making sure that there are good data to protect the health of many populations. So that's a little bit about what maternal and child health is. Should I tell them about our series?
Here's what I would want to add a little bit to what you said, because in all that conversation, you didn't mention that word I'm always going to talk about, which is men and fathers.
Oh, yeah.
And this is one of the reasons why how Dr. Wendy and I became connected, is that with the work that we were doing with fathers. And I actually applied and was accepted at the School of Public Health and Maternal Child Health to just explore more about how do we include fathers and males in this conversation around maternal child health. And I think that as a result of that work, it definitely has helped me in terms of the work that I've been doing. I always talk about the fact that it was probably one of the best journeys I went on educationally in terms of schooling, because there was so much that I learned. I learned, as I often say on this program, I learned what the big P was in public health. I learned about a lot of other things. But anyway, why don't we talk about the series? What did we come up with, or what did you?
Okay, I'm going to tell you what we came up with. But first of all, I want to say something else, though, about the father's piece.
Okay.
Is I do remember how we met, Clarence.
Okay.
We didn't meet when you applied to the program. We met before
Prior to
that.
Right, that's true.
Because you came to us.
Right.
And you said, look, fathers are not examined very much. People don't think about fathers. They don't think about them in the context of families. Your work, Clarence, you were thinking about them. And it was just our good luck that we actually looked at our history, looked at who we are, and said, look, they're a vulnerable population too. They're a population that is unexamined. We learn from you. So you and I began learning from you, and you know that's the case. So about our series. So now this was, maybe a decade ago, I guess you and I met, or maybe it was a little less than that. But we've been talking about putting together a radio series about maternal and child health topics that we think are sometimes underexplored, are very important to the public's health, and about which we have some expertise. We have people who want to help educate the public and professionals about these topics. So what we did is we sat down at a lunch, actually, and said, we're going to do it. And we invited people for September and October to come to the show and just talk about their areas of expertise. So tonight, I hope that you will talk a little bit about fathers and a little bit about the work you're doing. I'll talk about reproductive life planning tonight. But we invited other people. We invited Lisa Randall from the Minnesota Department of Health. She's going to talk about HPV and HPV vaccination. This is so important. If you think about it, the HPV vaccine is one of the few anti-cancer vaccines we have. It's incredibly important. Amy Gilbert is coming on October 5th. She's a graduate of our program. You know, she's going to talk about something that I've always wondered about, is just what should you do in a primary care health visit? And what kinds of things should you do to prepare, get the most out of a doctor's visit? Jill Ferris is coming on October 12th. She's also a graduate of our program. She's going to talk about teen sexual health, and that's so important. October 19th, Carrie Michaels is coming, and she's going to talk about children and mental health. Again, something that is such an important thing, and we don't often hear very much about it. On October 26th, Ed Ellinger, he is the Commissioner of Health for the state of Minnesota. He's coming to talk about work in health disparities. And what's really cool about Ed is he's also a faculty member of our Maternal and Child Health program, and we're doing a project right now with him, our program, in order to raise awareness about health disparities. And then I think in November and December you might have some other MCHers coming on to talk. Annie Fedorowicz, I think, is going to talk about immunization during pregnancy. Mm-hmm. So what we did is we reached out to our faculty, we reached out to our graduate, we reached out to our friends. We said, what are important topics for the public to know? How can we just put together a few shows? So we're going to have a great fall, I think, about MCH.
Well, I appreciate that. And the other thing, too, that I like about this series is that we're not shying away from topics that could be controversial.
No.
We want to be able to talk very honestly and openly with our community about some of these issues, and then to be able to allow them to have the opportunity to ask the questions that they need to ask. Because I think so many times we have this great institution, University of Minnesota, which is a land-based institution, which is really our U.
Yeah.
It's for the people, but we don't all the time get access to it. So, Dr. Wendy, why do you think this series, though, is so important?
I think for the very reason you said is, if we can reach out, if we can have people ask us questions, by asking us questions, it makes us think a little bit more about the nature of our research and help people understand what we do. We not only do research, but we also develop programs to serve the public's health, and we advocate for policies. So what we want is something that you've always encouraged, Clarence. It's dialogue. We'll share what we know. We'll share what we think is interesting. We want to hear from other people about, your audience. We want to hear, is this of concern to you? What kind of questions do you have? If we can't answer them, we'll try to direct people in a way that they will get their questions answered. I think it's a fun series because I think all of these topics are important to health. I just simply do.
Well, let's jump into the series. Let's talk about family planning, because I think it's one of your
Yeah, it's one of my
topics.
passions.
Yeah, one of your passions.
Yeah, it's one of my passions. And I think that's the thing about family planning is it's kind of again, something that's been around for a long time. We're talking about it much more differently now. We sort of talk about reproductive life planning, which is a different way of thinking about family planning. When I heard the term family planning when I was a young woman, I'm 60, so that was a while ago, I always just thought about birth control, and there wasn't a lot of options for birth control. The birth control pill was available, but there weren't a lot of options. Now we start talking about this idea of reproductive life planning, and we want the public to think about that. And that essentially is really thinking about whether one wants to have a child, and if so, when. But the whether part is really important because, as you know, one of the things I've been concerned about, Clarence, is the stigma around people who choose not to have children. And the choice to not have children is a legitimate one. And it's one we have to help support people in, too. But for people who want to have children, we want to ensure that they go into their pregnancies or begin the process of being involved in a pregnancy, if it's a man, in the best health possible. Best physical health, best mental health, best social health, because that's the way to start a pregnancy. That's the way to start a new life. And that's a way to make sure that new life has a great beginning and a great middle.
So let me be somewhat flippant here.
Be flippant.
Okay. In that all I thought you needed was a man and a woman to just make a baby. And that's all you needed. Somebody have a healthy desire to, healthy, unhealthy, whatever, to have a baby. And that's all you needed. So there are other things that happen or that you need to consider before you do those things.
Well, I think the one thing that we can, you're absolutely right about that. You've got the biology right.
Okay.
So, and I think we don't have to educate our viewers on the biology. So I think our listeners on the biology. The thing about, and you're not being flippant at all, this whole idea of planning, though, of reproductive life planning, it's really a very complicated and nuanced one in a way. I mean, I think most of us think, well, you just need a man and a woman and, maybe it'll just happen. But the reality is, in the United States, about 50% of pregnancies are unintended. And that has consequences. Oftentimes, women and men, they flow with it. They do fine with an unintended pregnancy. But sometimes it's quite life-changing. And what we think to empower people is to tell them about the importance of the good kinds of birth control that's really available now. But also, indeed, you need a man and a woman if you're going to have a child biologically, but to enter that pregnancy in really great health. Because the other thing we know is that a woman who enters her pregnancy in optimum health has the best chance of a healthy pregnancy. And what we mean about optimum health is we mean physical health. And I can talk to you a little bit if you want to hear about, just what a woman can do with a healthcare provider, maybe to ensure. We really encourage people to seek out a healthcare provider to talk about when and if they want to be pregnant. And if people are interested in pregnancy, they may want to think about a few things, like assessing their risk and the protective factors they have for a healthy pregnancy. Do screening. Do screening for sexually transmitted infections. Do screening for underlying chronic diseases. Do screening for substance abuse, for mental health issues. The reason you want to do screening is that you want to take care of problems before you get pregnant. We also want women to understand that it's important to consider their social environments as they enter a pregnancy. How can they make sure those are as healthy as they possibly can? And how can they make sure that they can have access to the medical and the psychosocial interventions they need? One of the things about pregnancy, too, is pregnancy is this just really short period of time. It's only 9 months. And in 9 months, one cannot cure all of the problems health problems that a woman may have. But if a woman takes, say, a year prior to a pregnancy to, for example, perhaps reduce her weight, optimizing body weight, very simple way of improving pregnancy outcomes. If a woman takes a year before pregnancy to get her prescription medication under good control, or maybe look for alternatives, for her to perhaps get her diabetes under control or any other kind of chronic condition she may have. And there are sometimes, during pregnancy, we really can't do some interventions. Like, for example, immunizations, like rubella immunization can't be done. And we also know that some of the things you do prior to pregnancy can, again, optimize those good birth outcomes like taking folic acid supplements. Everybody, well, not everybody, but many people know that folic acid, boy, it's simple. It's just pills. It's really simple. It's really cheap. It's so important to neural development of the fetus. But the problem is that neural development that's most protected happens in the first few weeks of pregnancy. So the reality is you start taking folic acid before you're pregnant. And that way you're sure that you've got adequate body stores to ensure healthy brain development so early on. So there's all this stuff that really kind of has to be taken care of. You know, the other thing you think about is substance use. We don't like to do interventions for substance use during pregnancy, and I would include tobacco use as well. Tobacco use by a mother is associated with lower birth weight, possibly with preterm risk. So you'd like her to stop smoking before she gets pregnant and not have to go through withdrawal while she is. People can also be screened for infections that can be treated better before pregnancy, also for nutritional risks. You know, I mentioned obesity is an important risk factor for pregnancy outcome. You can lose weight, you know, before you get pregnant. That's the best time. You sure shouldn't be losing weight while you're pregnant. But also, if you're underweight, it's a time to maybe get you to normal weight. And again, like we'd said before, chronic conditions like diabetes really should be in good control at the point of a pregnancy. So there's so many things to consider. This 9 months of pregnancy, that's not the time to be doing all of these interventions. It's really beforehand.
Well, you know, you mentioned a couple different things. You're talking about substance abuse. One of the things that we have really been pushing a lot in our health outreach has really been this issue around do not drink, 0 drinks for 9 months.
Yeah.
I mean, once you think about getting pregnant or you're pregnant, stop drinking because of the deficit, the impact that it will have on your child. And you know, there's just so many things that we don't even talk about. I mean, I you know, so many things. One of the reasons why I really wanted you to come, another reason I really want you to come, was that there's so many things that we take for granted. You know, like again, my flippant comment about it just takes a man and a woman. We take that for granted, but yet we don't realize the larger impact that will have upon the children or the community, those kinds of things.
Well, you and I have this public health perspective, which is, it's this really odd it's not an odd perspective. It's a wonderful perspective, but it's about populations and communities that we think, not so much individuals sometimes. I mean, one of the things that we'd like to make normal, common, is for people to think about a pregnancy as deeply as they think about buying a car. You know, it is actually a much bigger investment and a much longer term investment. And you made and so for population health, for community health, planned pregnancies are really healthy pregnancies. It's getting kids off to the best start possible, and that builds really strong communities. You made a very interesting comment about alcohol use. Alcohol use is normal in our society. It isn't necessarily a bad thing. However, and that's the funny thing about pregnancy, all this stuff changes. With pregnancy, again, we worry about the most extreme alcohol use, which can result in fetal alcohol syndrome. And that's rare. But again, the problem is that even exposure to alcohol very early in pregnancy can increase risk. And here's where the issues are. A lot of women have unintended pregnancies. They may not know they're pregnant until 9, 10, 12 weeks in even. If they don't know that they're pregnant, they will be using what is normal in our society to use, alcohol or tobacco. They don't know they're pregnant. What we'd love to make normal is people really thinking about this reproductive life planning, being aware that they have the capacity to become pregnant, or for men to be involved in a pregnancy, and to be thinking about, how do I prevent a pregnancy, or how do I create an environment that is the healthiest possible for it. So alcohol is a great example. when we consider 50% of pregnancies are unintended, unplanned in the United States, we know darn well that women are innocently ingesting things that could be dangerous. And that includes, by the way, Clarence, prescription medication, which they should be taking maybe, but not maybe if they're pregnant.
Right.
And so...
Well, it's really interesting. Again, I think that in this whole conversation, and we go back a long ways, to include men in this topic is very, very important. Mm-hmm. I remember when we had a conversation around preconception, I think that most men don't even think about it. I mean, if the lady wants a baby, let me help her. But it's very, very important that men understand that they have power as well. They may not have as many girlfriends after that, but they do have power as well to say no. Yes. Because of the consequences and the health of themselves and for their children.
Well, you know what? If we were creating our perfect worlds too, a lot of what I'm talking about when I'm talking about reproductive life planning involves a woman talking to a physician, and you're going to have at least one physician on the show in the next couple of months, Amy Gilbert, going to a physician and saying, look, I'm 22 years old. I don't want to get pregnant now, but I know I'm going to want to probably get pregnant in 2 years. We're talking about women. What we still haven't evolved to, Clarence, but we can always dream, is that men also can feel that they can go to a physician and say, hey, I'm 22 years old. I'm sexually active. I do not want to be involved in a pregnancy. What can I do? And I know we all think, well, we know exactly what you can do. But the reality is we don't give men language. We don't give men much permission to think about that. And in fact, we sort of demonize men a little bit if they get involved in an unintended pregnancy. So I'm kind of on your page here, and I'd love to see it where providers actually made the clinic a really good space for men to come in and talk about, someday I want to be a father, but not now.
And that's the next step I want to get to, because a little bit earlier in our conversation, you started talking about this whole concept about people who choose not to have children. Yeah. And that generally is kind of a very touchy topic for people. You don't want to have kids. What's wrong with you? I remember someone said to me that having kids helped to make you unselfish.
Yeah, well, you can't be a narcissist if you have a kid.
Right.
Yeah.
It's
not about you anymore.
Right. That's the best thing. But you're saying that that it's okay to consider not having children, and so what kind of conversation do you have with people?
Well, I don't know if that falls into the more opinion piece, I think. But what's really interesting is I think something you said is like, well, having a child made me less selfish. Well, you betcha it's going to, for about 18 years, make you a lot less selfish, that one child.
And maybe more.
One thing I would say is that children aren't interventions. Pregnancies aren't interventions. And sometimes people think having a child will make them better, or will make them feel safer, or will make them feel loved. That's not the way probably one should enter a pregnancy or parenting. One should actually enter, I suppose, parenting thinking, I'm going to make the world better for the child to come, my offspring. So it's an interesting thing. Children change you, but probably it's, and again, your anecdote wasn't quite there, but maybe it's not the right way to think about it, that I want a child to become better, or I want a child to make my life more stable, or my relationship more stable. That is a fairly selfish approach. The reason I'm interested in childlessness is in maternal and child health, we have a history of interest in disenfranchised populations, marginalized populations, socially vulnerable. And people who are childless are not often discussed. However, they're highly stigmatized in our society and most societies. Something is wrong with a person who has chosen not to have children, usually. That's generally the approach. Sometimes we just feel sorry for them, assuming that this is involuntary and something's wrong physically. But it's estimated that maybe 9 to 11% of the adults in the United States, age 45 and older, are by their own choice without children. They had opportunity, they chose not to. And actually, I'm one of those people. I always knew that it would be hard for me to be as selfless as I needed to be a good parent. And for a long time, my husband and I didn't have money. And that money I thought was important. I thought you had to have a little bit of money to have a kid. But what I'm interested in about childlessness is the stigmatization around it, that there is something wrong. And what I would hope in any kind of a community setting is that we allow people to express their ideas of family in whatever way they feel is appropriate. And sometimes family doesn't include children. And sometimes not having children, at least my husband and I have found, makes us much better, aunt and uncle, actually, because we've got a lot more energy for that. So I think it's in the decades to come, I think we'll talk more about childlessness because I think it is increasing in this country. It's increasing in most developed countries. Some people are childless because of population concerns. We have 9 billion people on this globe. There is really a question about whether we can keep having so many children. Mm-hmm. In fact, that was part of our decision, too. But I think as childless people increase, we need to find ways to accept them also and accept their choices.
It's interesting that you said that. It was in my own personal life recently. I had someone that was very, very close to me to receive a call from someone that was very, very close to us, apologizing for the fact that they had made a comment about her not being able to have a child. And that had happened. She made the comment 10 years ago, 10 young kid just making it. But somehow that bothered her, and she was thinking that this person that was close to me was all upset about the fact that she couldn't have children. Oh. And she just had explained to her, she says, no, I have a very, very happy life. So I know that what you're saying is true, that there are those people that for a variety of reasons, they cannot have them or they've chosen not to have them. And people seem to think that there's something wrong with them. And I'm of that opinion again. I mean, we probably arrived at this conversation at different routes, but I mean, we got 8.5 billion people on the planet. I'm like, whatever we got 8 plus. But anyway, you have to at some point decide, make some kind of decisions in your life, and those are things again that you have to talk with the people that you love and ask them questions.
And those are large, that's sort of your and my public health perspective is that making sort of very individual decisions based on social conditions. I mean, for me, when I was very young, I was aware of, at that time, the concerns about population explosion. I thought, what can I do? And I actually had a lot of concerns about the environment that went beyond, having children. I didn't drive a car until I was almost 30 because I didn't want to pollute, this sort of thing.
Sure.
The deal is that a lot of people do make these choices based on social concerns. And again, they deserve some respect. And instead of pity or scorn, just respect. And there are a lot of interesting books. I don't know if your viewers would be interested, but there's a book that just was recently written by comedians. It's called No Kidding. And it's written a series of essays by a group of comedians who are explaining why they didn't have children. And that they do get kind of tired at picnics when they're looked at with pity or scorn, It was just a choice.
Well, Dr. Wendy, we're going to continue this conversation in the next half hour. Listeners, you're listening to Community Health Dialogues. We're talking to Dr. Wendy Hellerstedt from the University of Minnesota. She's associate professor and she's the director of the Center for Leadership Education in Maternal and Child Health. And we're talking about maternal child health issues and our community. Have a great evening. We'll be back in about 30 minutes. Welcome back, listeners. It's a little bit less than 30 minutes. I think that's what I said when I ended the conversation, but I thought 30 seconds, but a little bit more than 30 seconds. But we're here in the studio talking to Dr. Wendy Hellerstedt, who is from the University of Minnesota, around maternal child health issues, and just kind of talking about a series that we'll be doing in the next couple of months on this particular topic, and hopefully it'll be of interest. Some of the subjects will be of interest to you, and we'll be able to inform our community about these issues and talk about ways in which we can engage our community to become healthier. So welcome back. So during the time out, we talked about men. And Dr. Wendy, you want to talk some more about what our fellow colleague over here said?
Well, I think the three of us, Q, you, and I, were talking about unintended pregnancy, and most of our information about it is from the woman's perspective, or from an adolescent girl's perspective, because we think that most adolescent pregnancies are unintended. What we don't focus on very much is what the consequences of an unintended birth actually are for men or for boys. And what we were talking about just among us is that's sort of like throwing men away in a way. There are some data that show that the consequences of an unintended birth for, both women and men is lower educational attainment, lower income, and there are some health consequences as well. And the one thing that we were talking about is for men particularly involved in an unintended birth, they may actually, if the relationship with a woman dissolves, they may lose contact with their child. And if we think about a woman losing contact with her child, we're just bereaved. I mean, that's just a horrible thing to think about. But what about a man losing contact? And the thing is I think we leave men out of this consideration. And in doing that, I don't think we're a very healthy society or community. Men are involved in pregnancies 50-50. And I think they have a right to be acknowledged as fathers. And the consequences of an unintended pregnancy are great for men.
And I appreciate that, because I think it's better. I mean, it sounds great, and it's good that it's coming from you as a director of a center like that. But I just want to ask you, how do you prepare students to engage the community? I mean, what kind of work are they doing in the community to really address maternal child health, or to help people to do better family planning, those kinds of things? What kinds of things are available for people to do family planning?
Well, as you mentioned, we have a maternal and child health MPH, a Master's in Public Health program at the University of Minnesota. We do have a website if people are interested. It's www.epi.umn.edu/MCH. That's a mouthful. Just go to University of Minnesota, Google it, and then Google MCH. You'll be fine. Okay, what do we do to prepare our students? Our program's been around for more than 60 years, Clarence. We have more than 1,100 graduates. So there's not a simple response, but you're very interested in what do we do to prepare people to be in the community. We have really, I think, a state-of-the-art in-class and online training. So people learn the basics of public health. They really have to. They learn content area. And as I said, maternal and child health is a lot more than just babies and moms. It's fathers, it's families, it's adolescents, it's children. But what do they do to get into the community? Well, the reason I mentioned those graduates we have out there, many of them are leaders now in the community. And I always say, I never let our students lose touch with us, because once they become our graduates, I always call them up and say, will you mentor a student? And this summer, you have been mentoring one of our students. So what do? We give them great classroom instruction I think all of us have pretty good research portfolios. We know what we're talking about. But we send them out for field experiences, or in the case this summer is you simply have a student that you are mentoring and helping her learn a little bit more about, actually your work in Africa as well as your local work. We've deployed students this summer to WIC. We've deployed students to the Department of Health. We just get them out there. We get them into clinics. We get them into public health agencies. They go abroad. About 30% of our students do work outside of the United States. We simply get them to roll up their sleeves, and they have at least 120 hours that they must have in the community, doing program development, doing policy creation, or doing research. So we have that component as well as part of our training. The other thing that we do, and it's so important, is I'm not kidding about not losing connections with people like you, with people like our graduates. I think about we use our graduates oftentimes to actually be our teachers, and that's another important component of what we do. So preparing them, right now we have about 80, 90 students who are active. They're doing all sorts of things. Not one is the same as the other. Some are interested in reproductive health. Several are doing work at Planned Parenthood, actually. Some are interested in children with special health care needs, and they're doing works in clinics. Some are interested in youth studies, and they're at various clinics and various youth-serving agencies across the Twin Cities and elsewhere. So
one of the things one of the things I wanted to do was to make that known to the community.
Yeah. And
if there are opportunities for engagement or for the community to utilize some of the students at the U, how do they contact you, or how do they?
Yep, I like
get one.
Yep. Well, you can find me pretty easily. Again, I love Googling University of Minnesota, Wendy Hellerstedt. It's HELLERSTEDT. You'll find out how to contact me. If you have an agency or a community project, you need a smart student, man, contact me. Let's just see what we can do here.
Right. Well, one of the things that you mentioned is the fact that this summer we're working with one of your students on creating a project for a program in Kenya.
Yeah, and tell us about that. Come on. In
Woman's Kind. Well, it's interesting that we were working with a group called International Leadership Institute, and we happened to meet this lady who happened to have been a former member of parliament out of Kenya. She had a group called Womankind, and there was an incident that happened in Kenya where there were some terrorists who actually were killing people. Mm-hmm. Our school happened to be next to the site. As a result of that, many of the students were underneath gunfire for about 14 hours. And so after the incident was over and the kids left and the teachers left, they took all the materials, all the bedding, everything was gone. And so she was here, soliciting support and help for that. But one of the things that happened during our conversation with her was was the need to have a conversation about how do you prepare a curriculum to talk to young ladies. And so one of your students, with your help, came by and we sat down with Sophia Noor, who was the person from the parliament in Kenya, and just started working with her. And so pretty soon we will have a curriculum that we will be able to send there and work with her in terms of helping young people, helping the young ladies to have a better life. I mean, that kind of stuff is exciting for me because I think that part of what I like to do is I like to see students who are able to work on projects that will make a difference. And I think in places like Kenya and other places where we have the opportunity to tap into your students, it's a great thing.
To get your mentorship. I mean, I think that's the other thing. And I know we can be a mutual admiration society, but we are actually quite careful, too, about where we send our students.
Correct.
We did deploy a student to you because we knew it would be a good experience. And I think that's one thing I want to say. And that was a great experience for her. But, I thought about something when you were mentioning your Kenyan project. Mm-hmm. We talk about reproductive life planning in this country. We have so many options to really help women and men plan their families. We have these long-acting reversible contraceptives that are available to us. We have clinics that make them, quite available. In places like Kenya, places in Africa, the key to women's empowerment is controlling their fertility, and they don't have what we have. Mm-hmm. And I always reflect on that. Mm-hmm. I reflect on how connected controlling fertility is to economic empowerment, educational empowerment. And the work you're doing in Kenya is about empowerment. Mm-hmm. But They don't have the resources that we have here. That's why I'm always very proud to talk about reproductive life planning in that kind of a context. Right. The work you're doing is fantastic.
I think, and I think that part of that really is by being made more aware of what are the options, making people more aware of where they can seek resources, those kinds of things. I mean, to me, it's just important that people understand the consequences of their behavior, their actions, and things like that. And we can get off on that, from a different perspective. But I want to ask you this: what is going to be your legacy? You're at the university and you've been there for a while. What's going to be your legacy?
I think thinking that one has a legacy is more grandiose than I'm able to do.
Okay.
I am a first-generation high school graduate.
Okay.
So for me, that idea of legacy is pretty hard. But I'll tell you something that gives me pride, and it probably shouldn't, because I can't really take attribution for it. My legacy might be I have tried to be part of forming a very strong MPH program that has kept social justice at the forefront. I have tried to be the kind of instructor, and I've been acknowledged for that, that has brought up tough things and encouraged dialogue. So it wouldn't be my legacy, but with great pride, I think about the leaders that our graduates have become. I mean, you're going to have some of them on this series. I keep coming back to this series, but for me, you don't understand the thrill it was when we were putting together just this 2-month series to think that I would be contacting our graduates, people I recall as students, and now they're leaders. So not my legacy, but my privilege has been to be part of training so many people. I mean, that's amazing. That's just amazing to me. So I don't know that I have a legacy other than trying to talk about the tough stuff. I hope in the next couple of years I can get us to talk more about climate change. I hope we can talk more about destigmatizing childlessness. It is often volitional, and I don't like stigma where it exists for anything. And I hope that we can continue to get the best and the brightest students to our program, because my goodness gracious, public health is just that. It is the public's health, and we need the best and the brightest.
What do you think are some of the biggest challenges for us as a community in terms of the future when it comes to family planning?
Well, I think economics are going to always be a piece of it. The Affordable Care Act meant to provide us with preventive care and contraceptives, and it's constantly being challenged. I think that's going to be a challenge in the community. I think another challenge in the community, it's my own challenge as well, is how much information is out there and how much of it is poor. There are people who, one thing I think about is the poor information about the so-called dangers of childhood immunization. People have been made absolutely petrified about immunizing their children. My goodness, immunization is a public health success. We are not having children dying of polio. We're not having children dying of measles, for goodness sakes. I mean, it's a success. So I think a challenge in a community, and I think about this a great deal. I was a journalist before I was a researcher. And the challenge is, even for me, when I hear stuff, I have to always filter it. And I think some of the naysayers are really pretty effective. And I think that the community, rightly so, doesn't trust stuff. They don't trust stuff from the university. They don't trust stuff from anyone. And I think that's because what we don't convey very well, Clarence, is uncertainty. And I don't think we convey very well that knowledge changes. This is very true in nutrition. You know, when I started out in graduate school, I worked on weight loss trials, and we were telling everyone to eat very low-fat diets. We were wrong. But we didn't know. It was the best science then. And I think for people, legitimately say, I don't know what side is up. You know, you say this, and now you say that. So I think that's a challenge. For reproductive health, I think there may be the biggest challenge, though, is economics. And I think the second challenge, again, is misinformation. Right now, the IUD is very safe and it's very good. The IUD with progestin, it lasts for 3 years, simple insertion. And for 3 years, you're protected from pregnancy. But there still are these myths in the community that it's dangerous. And it's not. So I think misinformation still. But economics, big one.
Good. You know, Dr. Wendy, when you and I first started talking, we talked about this whole issue around public health. You know, we talked about the issue around public health and its role in terms of family planning. Mm-hmm. Health is around this particular topic.
Sometimes we need to start from the point of view of the individual, the potential mother, the potential father. And sometimes it's just saying what we believe to be truths and having people kind of think about it themselves. One is that having a child is not an intervention. Mm-hmm. Not for you, it isn't. As a potential parent, having a child is a long commitment, 18 years at minimum. And again, your approach when you think about that is, what can I do best for this potential child, not how it's going to serve me. So in terms of public health, what we want to think about is what makes communities strong. Public health is more than just individuals, but we start at that place. A strong community is men and women who are able to get the educations they want, get the employment they want, and have the lives that they want, and to plan their families in the way that they want, to not have the surprise pregnancy that oftentimes, by the way, they handle very well, mm-hmm. but not to have that surprise because you can control it. A strong community is really healthy babies and really, really healthy children. And healthy babies, healthy children, healthy youth who learn and who have environments in which they can learn, and who are in families that are prepared to give them those environments. And that should be something that is available to all communities, and that it should be a goal for all communities. And we should bring out the resources in public health. And in this case, it's reproductive life counseling, it's access to contraceptives. There are lots of clinics locally and throughout the state that provide very low-cost or no-cost counseling in these areas, Planned Parenthood being one of them, North Point being another one.
Which is one of the sponsors for our show, so we thank you, North Point.
And the medical director of North Point, Paul Erickson, is one of our graduates.
Oh, Paul Erickson.
So there you go.
Dr. Paul.
There
you
go. Yeah.
Okay. We are, at a point right now in this country, we need to talk more about this issue. What are some of the other topics you think we should be bringing up? For example, I know that when we were talking before, and I mentioned this to you a little bit earlier, is that when I went to the School of Public Health, we started talking about breastfeeding. We're talking about maternal child health issues, but there are a lot of issues, that we're not going to cover in this 2-month period, but there are a lot of topics that are important. Mm-hmm. But I want to, from your perspective, because I can get off on it in my own kind of way, but from your perspective, why is it important for us to talk about breastfeeding, and especially for men?
Yeah. Well, I hope that you have one of our colleagues speaking about that issue, possibly for November and December. The reason that breastfeeding is an important topic is that it's, one of the things, and you and I are always sort of straightforward about it, breastfeeding isn't always easy. Mm-hmm. And I think sometimes, and this is part of the miscommunication, is that from public health perspective, sometimes we portray it as just this lovely, wonderful, easy thing to do. It's not always easy. However, there are good data that show that it really is the best food for a baby. Mm-hmm. And that's what's really important, is it really allows the child to be protected from a lot of infections. And there's just a ton of data about that it's best for baby, probably best for mom too, in terms of bonding. But you said from a male perspective. Mm. And again, yeah.
Well, I think from that, because when I went there, I and the professor was talking, he was saying, like, if you allow your baby to breastfeed, mm-hmm. It'll increase their IQ a couple of points. might make them stronger. I mean, there are a lot of guys. I think about a lot of guys who say like, I want the smartest,
the smartest,
strongest,
baby.
healthiest baby running around, and so we're trying to give them a head start. You know what I mean? So this is one of those ways where you can give them a head start, right?
Well, it's simply put, it's the best food for a baby.
Okay.
It is the best nutrition for a baby, and it also helps a baby avoid infections to some degree. So your baby is going to be stronger and healthier if he or she is not crying all night with an ear infection, which could lead to worse things. Your baby is going to be stronger and healthier if he or she is gaining weight at a good pace. There's no question about it. The attachment data are very clear about developing a strong bond with mother during the breastfeeding process. And that is actually, babies actually very early on build their emotional and their intellectual intelligence. So you definitely want to have that. And for men, that you can say this is it. But men can also be somewhat involved in that milk can be expressed from the breast and bottle fed. You put breast milk in a bottle, and dad can feed this wonderful food to the baby. So this is absolutely something that shouldn't necessarily exclude a man. He's just feeding breast milk from a bottle.
Okay. Now I'm going to talk to you about a topic that you and I have talked about, and it was one that was sensitive, but it was the National Children's Study. Okay. And I was so fortunate to be one of the individuals that was selected for that. I was one of 7 at the end that was a part of that study. But the study was around the environmental impact on kids. And you had mentioned environment a little bit earlier. So I just want you to just talk about the importance of us understanding that the environment does have an impact on us. Give us some give us some encouragement. I mean, really to kind of get involved and looking at that topic, not from the National Children's Studies perspective, but, as parents understand that this is an important issue, in this generation.
Yeah, and the environment is described in so many different ways. I mean, there's the physical environment, there's the emotional environment. You're right to talk about the National Children's Study. It was a very large aim. You did play a very important part in it. It was such an expensive study that it ended up being not terribly sustainable. The reality is that we need more research into children's environment. And in terms of, I know that it's so important to talk with people who are not researchers about the importance of research. Sure. If we don't have people participating in studies, we are never going to find stuff out. This is how it's through research that we found out that lead-based paints were so dangerous to children. The National Children's Study, but just generally our approach about environment is, what is the physical environment that surrounds actually the pregnant woman? Because we think that in utero or fetal environmental risks exist that can actually program a fetus to have either good or poor health. And we know that there are some data that support that. So when we think about an environment for a child, as you well know, we think about the environment that the pregnant woman is in. That's why we say, please don't use tobacco products. That's why we say, please don't use alcohol. A woman can use alcohol, substances, whatever. It will change potentially the development of major organs in that fetus that we cannot reverse. So that's important. So that in utero environment's important. The environment a child is born into and grows up into is very important. There was some recent data that showed that an infant of just several months of age who is exposed to a lot of noise may not sleep adequately. And by not sleeping adequately, did poorer on learning tests, even as an infant. We have to recognize that infants are laying down their patterns of learning, and they may not seem to be, but they certainly are. Their brains are developing all the time. So we have a lot more to learn about how important noise may be to children, sleep may be to children, all of these things. So there's a world to learn out there.
Well, Dr. Wendy, I want to thank you for being on the program tonight. We're at the end of the show. It has been a pleasure. And listeners, I want to let you know that we have some other speakers that will be coming in to help us around this topic of maternal child health. And we look forward to having you back with us again next week. Have a great evening.
Thank you for listening to Community Health Dialogue, sponsored by North Point Health and Wellness Center. Join us next Monday from 6:30 till 7 for more discussions for a healthier community.